My name's Mark Widgery. I'm a GP and co-founder of MedLink. Our online review system aims to help manage practice workload while still maintaining practice control and keeping or enhancing the clinical quality of our work while not introducing new clinical risk. We wanted an online solution that was accessible to all of our patients so that everyone could access it regardless of their level of digital literacy. And so our solution focuses on online reviews of long-term conditions, and we're currently live in around 200 practices covering 2 million patients. We've created MedLink reviews covering all of the major long-term conditions, respiratory, cardiovascular and others, along with a structured medication review and specific medication reviews for pill checks and HRT. We have mental health checks covering major mental illness along with depression and anxiety, health checks for learning disability and postnatal, monitoring of blood pressure and weight, and administrative MedLinks covering new patient registration and updating contact details. You continue inviting your patients for review as you always have done using your existing communication tools, whether that be text message, both in bulk and individually. You can also send the links along with scannable QR codes inside letters, or share the links with patients by email, or also make them accessible via your website. What you see here is a brief version of our asthma review showing the patient perspective. A text message arrives on the patient's phone, which has the MedLink inside it, which they simply tap on to load straight into the online review. You can see here that each practice has the ability to customize the content with their own branding and logo, and after the introductory section you can also upload your own video as a practice, and this just really helps with patient engagement to reassure patients that what they're seeing is something legitimately from the practice. There's no download, no registration, no login required. A patient simply consents and completes their name, as well as in the full version their date of birth to confirm their identity for the practice. And once they've done that, they're into a structured clinical history. What you're seeing here is the asthma control test questions. As you can see, these are very text-heavy questions, but we also try to incorporate images and videos into the review to make it a more engaging experience for the patient and also more useful for you as a practice. So here the patient selects the type of inhaler that they use, and with an MDI the type of spacer as well, and they're shown a very focused video explaining how the inhaler technique for their specific circumstance. They can interact with that video and express if they have any concerns, and then you can provide targeted patient information. For example, here a patient is a light smoker and is shown smoking cessation advice within the MedLink, and was also sent to smoking cessation links after they complete it. One of the real powers of MedLink is the ability to gather all the information from your patients in a really thorough data set to allow you to provide a really high quality and thorough remote review. We ask patients as appropriate at the end of the reviews how they feel about their control. We don't promise that it's going to be possible, but in many cases a remote review is entirely possible with very little, if any, further interaction directly with the patient. And once they've completed, you're able to customize the content and signpost patients to local services. Here you can see a stop smoking service within Oxfordshire, and you can customize that content for your own purposes. When we first started this process, we assumed that we would be playing a young person's game, but as you can see from this graph, our experience has been very different from that. The average age of patients engaging is just under 60, and we've had patients in their 80s and 90s receive a letter, scan a QR code with an iPad or a phone, and engage with a very useful online review. The summary document that you can see here is generated from the patient responses. Originally, this work was all done manually within the practice. MedLink would send that document via email into the practice, and you can see here on the left we have coding templates for EMIS PCS, and on the right the vision code entry templates. The PCS templates are still available, and so we can still be live in EMIS PCS practices to help with that, but as practices move over onto the vision system, we're now pleased to inform all of our clients that we offer direct integration with the vision clinical system. So the patient is invited and the MedLink completed, and rather than just the document coming in by email and being manually coded, all of that information comes into the MedLink manager itself. Here you see the inbox itself, showing how long each completed MedLink has been there. You can filter by reviews, search for patients, and filter by assigned individuals and teams. Once you identify a MedLink appropriate for you, Loading it opens up the main data page. Firstly, you can see why it has come to you or your team, and if necessary, reassign that MedLink to others. Patient submitted data is shown on the left, with codes clearly highlighted with the blue tick. Recent data is pulled from the patient record for comparison. All of this is presented to the clinician to enable efficient decision making. On the right is the Workflow Actions section. Messages to patients via email or SMS can be sent as follow-up, including templates to make message writing easy. Clinical comments can also be added. For the asthma review, action plans can be edited and previewed. Details of the patient's upcoming appointments are pulled directly from the record, and if a follow-up appointment is required, you can invite the patient to book it directly in the message you send them. After selecting the appointment type, the system checks that appointments are available. At the end of the clinical evaluation of the MedLink data, you click File to Clinical Record. All of the patient data, including codes, along with your message and your clinical comment, are all written directly to the record, requiring no additional admin input. Data is stored in Vision as a normal consultation, shown here in both Vision 3 and Vision Anywhere. If relevant, the patient message contains a link allowing them to book into the appointment type you have selected and receive a confirmation email once they've done this. In summary, the MedLink data supplied by the patient is presented for clinician decision making within the MedLink Manager. Once those decisions are made, follow-up messaging and automated appointment booking is available, and critically, all of the patient data, plus a record of the decisions made, is automatically entered into the patient record. The move from manual coding to MedLink workflow saves admin and clinical time and allows direct patient messaging and follow-up to be arranged. To maximise practice flexibility, we also offer a middle-of-the-road option called Auto-Code and Email. MedLink codes are added automatically to the record, but the summary document is still sent by email and added to the practice document workflow, most commonly DocMan. This allows the benefits of auto-coding while not requiring clinicians to check and manage a new inbox. This can be adjusted by each individual MedLink, and we also allow specific MedLinks to be sent to a separate email address. MedLink overall is a significant time saver. Taking asthma as an example, about 2/3 of reviews can be completed in less than 5 minutes of clinical time without a further consultation. And even when a follow-up consultation is necessary, this can be very focused on clinician and patient concerns since all the data gathering is already completed. MedLink improves the quality of your review process by engaging those who might not want to attend the practice. Each review is a clinically thorough and comprehensive data gathering tool, with all data robustly coded into the record. MedLink improves efficiency by allowing you to risk stratify your patients, focusing clinical time on those who need it the most. MedLink works best when integrated into your recall system, and asynchronous consulting means your staff have flexible task-based work, in contrast to standard appointments. If your health board is signed up to the Fast Screening Local Enhanced Service, MedLink automatically gathers and calculates the FAST score during each review. This is worth £1.50 per screen, and combined with the follow-up brief interventions, can easily generate revenue of around £500 per 1,000 patients per year. Our MedLink Manager gives you metrics on the practice usage of the system, as well as a view of your patient's feedback. You can customize the material. Here you can add practice branding to help patient engagement. And you can also add to the review content to include your own specific questions, as well as signposting patients to local services, such as alcohol, weight and smoking support. Patient feedback is excellent, with around 90% of patients saying they would recommend the system to family and friends. We offer new practices a 3-month free trial with an annual cost of 11p per patient, with discounts available for bulk orders by clusters and health boards. The use of MedLink reviews releases clinical capacity worth many times the annual subscription. Please see our website or get in touch for more information.